The surgery that we do for colon cancer typically is the same, depending on where the tumor is, it's anatomically the same, right? So if you have a tumor in the right colon, you're going to get a right colectomy. And for the most part, all of us that do colon surgery are going to do essentially the same surgery. We're going to take the lymph nodes, we're going to do the same kind of connection, whether it's open or laparoscopic or robotic. That's true of the left colon, transverse colon. Again, it's an anatomic dissection, right? So you're going to get essentially the same operation. Well, whether the outcome is the same, and your recovery is the same is maybe surgeon dependent somewhat, certainly patient dependent. But essentially, we're all doing about the same operation each time, with room for judgment, of course, and depending on the stage of diagnosis and what's possible, based on the patient parameters. Recovery, and I've got great data on my colon surgery from robotics. We have totally changed the curve on recovery. So again, whereas most patients will be in the hospital somewhere between 3 to 5 days, sometimes longer if they've had open surgery, with robotics, I've had patients go probably 30% go home the next day, the day after operation. Totally comfortable, passing gas, eating. Of course, there's pain associated with surgery, but this is really one that we've gotten down to where it's very minimal discomfort.